Namaste and welcome to our channel. Today we are diving deep into the fascinating, rich history of plastic surgery in India, its modern advancements, and why India has become a global hub for medical tourism. Whether you're curious about ancient Ayurvedic techniques or modern board-certified surgeons transforming lives, this video has it all. Did you know that India has a history of plastic surgery dating as far back as the Vedic times, nearly 4,000 years ago? Yes, that's right. Ancient India laid the foundation for many surgical techniques that are still relevant today. The earliest documented evidence of plastic surgery in India comes from the legendary text, the Sasustra Samhita, written by the father of ancient Indian surgery, Maharshi Sasustra. This text detailed groundbreaking techniques like skin grafting, earlobe repair, and reconstructive surgery. The basic principles and techniques of plastic surgery, such as planning, puncturing, excision, extraction, suturing, precision, and the control of bleeding and clotting were set out in his text. Sasustra described the reconstruction of noses using a flap of skin from the forehead, a procedure still referred to as Indian rhinoplasty in the medical world today. Sasustra documented 300 different surgical procedures and 125 different surgical instruments, including 28 types of dilators, catheters and syringes, and countless types of scalpels, knives, needles, and suturing instruments, made mostly from the bones of animals and birds. As a result of his works, a staggering 1,120 different diseases and ailments were treated. Fast forward to today, and India has become a global leader in modern plastic surgery. With state-of-the-art hospitals, highly qualified and board-certified surgeons, and world-class infrastructure, India offers a range of procedures, from aesthetic enhancements to complex reconstructive surgeries. Jain Med are the first one to provide jejunum vaginoplasty in India, along with PPV, colon, hybrid PPV, penile inversion, and many more reconstructive surgeries. What makes India unique is its perfect blend of ancient wisdom and cutting-edge modern advanced technology, ensuring not only exceptional results, but also compassionate care. In recent years, India has emerged as a preferred destination for medical tourism. Every year, thousands of patients from across the world, including many trans individuals seeking life-affirming surgeries, choose India for its affordability, expertise, and high success rates. We appreciate that the prospect of medical tourism is a daunting one, and therefore we take care of every aspect of the process for you. From initial inquiry to post-operative follow-ups, once you have returned home, we are there every step of the way. Our competitive rates offer a transparent, all-inclusive price. We assist in obtaining your medical visa, offer airport pickup, and accompany you to our recovery apartments. We provide all transfers between our apartments and the hospitals and clinics. Our pricing structure includes your stay at our apartments and all meals whilst in our care. We arrange and include all necessary pre-operative assessments, evaluations and consultations. These include blood tests, CT scans, ECGs, X-rays and psychiatry reports needed for SRS. Once in hospital, we include all OT fees, surgical fees, hospital fees, nursing fees and follow-ups. We include any surgeon-prescribed medications, such as any post-operative necessary antibiotics and pain relief. We offer optional inclusive leisure activities, such as mall visits, movie theatre trips, and if you want to experience the sights and sounds of Mumbai, we take you on a sightseeing tour of the famous historical and modern landmarks of our diverse and beautiful city. For those of you with more time to spare, we also arrange and include trips to other parts of our beautiful country, from the snowy mountains of the north to the beautiful beaches of the south and everything in between. When you are in our care, we don't think of you as a patient or a customer, we think of you as family. Lifelong friendships have been formed between patients staying with us who then return to their home countries and keep in touch with both us and each other. Plastic surgery procedures in India can cost up to 60 to 80% less than in Western countries, making it a more accessible option without compromising on quality. To reduce these costs even further, we offer additional discounts on bookings for surgeries within 30 days, subject to availability. India is home to some of the best board-certified surgeons in the world, many of whom are sharing their knowledge internationally. Indian surgeons are highly regarded worldwide, and the statistics reflect their growing presence and impact in the global healthcare landscape. Many Indian-trained surgeons have become leaders in their field, with a significant number of them practicing in countries like the United States, the United Kingdom, Australia and Canada. Here are some key points related to Indian surgeons and their influence globally. In the US and Canada, according to the American Medical Association, the AMA, approximately 15 to 20% of physicians practicing in the United States are of Indian origin, with a significant portion being surgeons. In Canada, the number rises to around 25%. Many Indian American surgeons hold prominent positions in academic institutions, hospitals, and health organisations. Several have contributed significantly to medical research, innovation, and surgical advancements. In the UK, Indian origin doctors make up about 25% of the UK's medical workforce. This includes surgeons in both the National Health Service and private sectors. Indian doctors have a long-standing role in the NHS since its inception in 1948. Over the years, a significant number of Indian surgeons have risen to prominent roles in British healthcare institutions. Since the advent of the NHS and right up to current day, Indian-born and trained surgeons are highly sought after by the UK and offer generous incentives to move their families so that the UK can benefit from Indian expertise. And yet some people still think of India as a third world country. Indian surgeons contribute significantly to international medical research and have published extensively in medical journals. Many are involved in groundbreaking surgeries, especially in areas like minimally invasive surgery, organ transplantation, and robotic surgery. When matching you to an Indian surgeon at JaneMed, we take into account your specific needs and goals to ensure that you get the right surgeon for you. We perform our own background checks on everyone we work with, sourcing independent reviews of their work. We only associate with the very best surgeons with a wealth of experience in their own specific fields. JaneMed is your one-stop solution for all your needs in dental, cosmetics, hair transplants and plastic surgery at affordable prices. Proudly presenting India worldwide.